Hello, my name is Kiran Bhagat, and today we're going to continue our series on cardiovascular disease. We've talked about the prevalence, we've talked about the lifestyle things that we ought to do in terms of the diet, and today we're going to talk about screening for cardiovascular disease. How do you actually know you have a problem? The principal issue with cardiovascular disease is to remember that they are largely silent. They don't cause symptoms until the very end. You may not know that you have blood pressure until you develop a severe hypertension where you get headaches and dizziness. The early signs of blood pressure are silent. We've talked about this many times before, where it is a silent secret serpent is my favorite one, which travels through the body and eventually causes a multiple number of conditions. And the only way for you to understand, and blood pressure is important because it is the commonest cause of death worldwide. It is higher in incidence across the planet than any other condition you can mention. It's higher than cancer, it's higher than HIV, it's higher than diabetes, it's higher than stroke. And the reason why is because of the lifestyle diseases we've talked about. The lack of exercise, the sedentary lifestyle that we live, the foods that we eat, particularly sugar. And the best way to measure blood pressure is to actually use the ordinary cuff that you go into a clinic. When you go and have your blood pressure tested, and you should be testing your blood pressure at least once a year, over the age of 25, once a year. If the blood pressure is normal, then annually. If it's not once, if it's high, you must go back and check it again. Make sure the blood pressure is less than 120 by 80. It's not the program to talk about the technical reasons of what 120 by 80 is, but 120 by 80 is something that should be burnt in and etched into your brains. It is not true, as many elderly think, that as you get older, your blood pressure is allowed to rise. Whether you're 20, whether you're 25, whether you're 85, whether you're 125, your blood pressure should be 120 by 80. We know, for example, if your blood pressure is 140 by 90, you will lose 10 years of your life. Not today, but in over a course of time, because this is a chronic disease. It's a lifestyle disease, and it causes havoc over time. It doesn't cause heart attack and stroke in 2 or 3 days. It slowly erodes the circulation, eventually resulting in an enlarged heart where you can't breathe and you get breathless, or you get palpitations where your heart begins to thump, or you get dizzy because your blood pressure is so high it's actually knocking on the brain's door, ready to cause a stroke. These are the things that blood pressure causes, and the best way to screen is to have your blood pressure measured. When you have your blood pressure measured, make sure that you are calm and relaxed. If you've rushed in, or you've had an argument, or you've had a bad night, or you've been arguing with your spouse or your partner, and you go and check your blood pressure, it's going to be high. It's high because you're in pain. You know, you've got a joint pain, you've had gout, or you've had an argument, or you haven't slept. That doesn't mean blood pressure. It just means you need to recheck it when you're chilled and more relaxed. If the blood pressure consistently is elevated with the appropriate cuff, make sure the cuff is not too large, not too small. Make sure that the nurse measures it at least 2 or 3 times to make sure he's got an accurate measurement. And if it's more than 120 by 80, have it rechecked. If it's consistently elevated, it's time to begin to initiate appropriate treatment, which is not necessarily a pill. There are dietary approaches to stopping hypertension. There are exercise mechanisms. If you're stressed, there are ways we can actually manage the stress in terms of mindfulness, in terms of meditation, in terms of exercise, in terms of breathing and breath work. So talk to your clinician or your nurse or your doctor about natural ways to approach managing from a dietary as well as lifestyle perspective if your blood pressure is borderline. If it's 140 or more by 90 and you are somebody that has already complications, there are other things we need to test. For example, you need to do an ECG. An ECG is what's called an electrocardiogram. That looks at the electrical circuits of the heart and how it communicates with the brain. The doctor can tell whether the heart is abnormal, whether it's beating unusually, whether it's thickened, whether it's swollen, whether you've had a heart attack, whether there's damage. That's called an electrocardiogram. In America, it's called an EKG. Same thing. Then you can have, if your heart is not looking good, or you take an x-ray of the heart, which shows that the heart is enlarged, you then need to have what's called a cardiac scan. That's called an ultrasound of the heart, or an echocardiogram, where we look at the size of the heart, the structure of the heart, the architecture of the heart, the blood flow of the heart, the valves that are opening and closing in the heart, the thickening of the heart, the calcification of the valves, the blockages that occur in the heart. These are things we can tell on an echocardiogram, and those things should be available in most good centers across the world. An echocardiogram is done, an x-ray is done, an ECG is done, a blood pressure measurement is done, and then you need to have some blood tests if you have blood pressure to see if other organs in your body have been damaged. You check your sugar to see if you're diabetic. You check your cholesterol to see if your cholesterol is elevated. You look at your kidney function to see if your kidneys have been affected. You look at your liver function. And if all those are normal, then you principally need dietary as well as perhaps medication to stop your blood pressure. So that is the screening for blood pressure. In terms of heart failure, where your heart is enlarged and the X-ray shows that the heart is enlarged, we call it cardiomegaly, you need to have an echocardiogram. If you're having signs of a stroke, if you're having numbness, slurred speech, dizzy spells, forgetfulness, weakness in one or other of the arms, failing to talk, failing to understand, failing to recognize people, you need to have what's called an MRI or a CT scan of the brain, where we look at the structure and the blood flow in the brain to see if there are any damages that have occurred from blood pressure or whether there's any bleed in the brain as a result of a stroke. If you have issues where you have kidney failure, symptoms of which may be nausea and vomiting, loss of weight, loss of appetite, change in the color of your skin because you're beginning to accumulate some of the toxins that are not being flushed out. The kidney function test will tell you, and a urine, the quality of your urine will tell you very much about whether your kidneys are manufacturing good quality urine or not. So these are the screening tests we use in detecting some of the conditions that we are talking about. Remember, they are primarily silent in origin, and therefore these are mandatory, particularly if you are the sort of person when you look in your mirror and you say, am I overweight? Do you think that am I looking in the mirror and looking at somebody who doesn't exercise, who doesn't sleep well, who's eating in excess, who's overweight, who possibly is diabetic, who has a family history, who is a smoker, who drinks too much? If all of these things, if you tick some of these boxes, you should go and see your practice, your practice provider to make sure you get a screen. Prevention is better than cure.